For context and analysis is Dr. Jenny Villavicencio of the American College of Obstetricians and Gynecologists. Doctor, many of these states we know do have some exceptions to their abortion bans, particularly in the scenario that the life of the mother is considered to be in danger. Of course, that's not always black and white. This is an area where you are very familiar. So can you kind of enumerate for us the health risks that could be at stake here and why it's not so cut and dry of a mother's life being at risk and potentially a mother might have to go to another state for an abortion?
It is not always clear when someone is in crisis or when, quote unquote, someone's life is at risk. These laws are being written and being passed by people who do not understand the medical science and who are not experts like I am. And so when they say that there are exceptions for the life of the mother or for the life of the pregnant person, what that says to me is that I have to make a decision in a potentially life-threatening situation, whether that patient in front of me is sick enough for me to risk the consequences of the law. I have to think about whether I'm willing as a physician to face criminal, civil, or professional penalties for providing the best possible care for that person.
And I know on that subject, the president of the American College of Obstetricians and Gynecologists said that today's decision is a direct blow to bodily autonomy, to reproductive health, patient safety, and health equity in the United States. Obviously not mincing words. But beyond simply what this might mean at an individual level, can you give us an idea of what you think the big picture of this new reality might be in the United States?
Absolutely. We are in a healthcare crisis in this country. Oftentimes I have patients come to me and say, I'm a mom of 3. I need to have this abortion so that I can take care of the kids that I have. I'm dedicated to them and I want to be able to be there for them. We have people who are deathly ill because of their pregnancies, but don't meet the criteria of life-threatening at that moment. We have people who have devastating diagnoses in their pregnancies, and they're going to be unable to reach and have this care. It is an absolute terrifying reality that we're entering into, particularly in the context of the racism that we're seeing in the healthcare system, Black women, Indigenous women, and Hispanic women dying at higher rates than white women, all amidst taking away rights for everybody and all families and all Americans.
Doctor, our polling shows that most people do not want Roe versus Wade overturned and that the vast majority of Americans are in favor of abortion rights in at least some capacities. But there are millions of Americans who view this as a hard stop issue, and they view a fetus as a living human being. And they say, regardless of how you feel, that is a human life, and doctors are obligated to protect the human life, and abortion goes against that. What is your response to the people that believe that?
My response often is that I used to believe that too. I grew up quite conservative and was actually an anti-choice advocate well into my early 20s. What changed my mind is taking care of people who are in crisis, taking care of people who are coming to me asking for help, and realizing that they are the lived experts in their lives. They are making these decisions thoughtfully and with compassion, not only for their families that are there and their children that are there, but also for their pregnancies. And I realized that pregnancy and life are incredibly complex. And that while abortion, yes, may be ending a potential, it is ending a pregnancy, it is also allowing the person who is pregnant and having an abortion to continue to thrive and live in their life. And we are saving that life and we are affirming that life, as well as the families and neighbors that that person touches. People get abortions regardless of what their identity is, regardless of their religious faith, regardless of their profession, how much money they make, what kind of education they have. I do abortions for young people, for grandmothers, for doctors, for people who are homeless. I do abortions for all types of people because all types of people need abortions. And so I ask the people who have a hard stop, who are thinking about abortion in a black and white way, to really look at their communities and their neighbors and realize that this is not in any way, shape, or form a black or white issue, not medically, nor is it morally. And we need to support our neighbors and recognize that they have a lived expertise in their own lives, and they're able to make these decisions with thought and with compassion and with love.
Dr. Villavicencio, thanks so much for your time.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.